20 years ago, I checked myself into the hospital 3 times thinking I was having a heart attack. However, my doctor said, it's just stress. So he put me through all the tests, barium stress tests, etc. I passed. Everything was fine. So when this event took place, I'm thinking, it's just stress.
He said, I don't know what's the matter with me, but I have pains in my chest again. So I said, are we going to the hospital? No, it is just stress, Pam.
I realized something was different, but I'm not going to the hospital. It's just stress.
So I drove him to the doctor's office, and immediately the doctor just ushered us right in. He put him on the EKG. He goes, Pastor Miller, I do not like what I see. And he sat back in his chair and he goes, I have one more question. Are you ready to make Mrs. Miller a widow today? And with that, tears came down his face, and he said, I will go.
That got my attention. All right, I'll go to the hospital. And then my wife asked, where do you suggest we go? He said, Hunterdon Medical Center. They have the best cardiologist. They've got a great cardiac program.
After evaluating Mr. Miller in the emergency room, we had recommended that he stay overnight for further observation and testing. We had started him on some medication, anticipating that his chest pain was cardiac in nature, so we wanted to be cautious.
And he just looked at me and he said, Bryan, you are having a heart attack.
We recommended that he undergo a heart catheterization or an angiogram.
And he hoped he'd be able to find a blockage that he could put a stent in. If not, he said, I'll be taking you off the table and we'll be talking about open heart surgery. When he finished explaining everything to me, he walked through the doors and he went outside to where my wife was.
He was very kind, he was very caring, very compassionate, and took a good 15 minutes explaining to me exactly what they were going to do.
Heart catheterization is a procedure that allows us to look at the arteries around the heart to identify if there's any blockages or abnormalities within them that would potentially explain a patient's symptoms. It's done in the cath lab under sedation. Traditionally, the procedure was always done through an artery in the groin, but over the past 10 years or so, we've transitioned and now do the procedure through an artery in the wrist.
I don't know if you can see it, but right there is the hole. I never knew that they could treat the heart with that small of a hole.
That catheterization confirmed our suspicions that he was having a blockage. That was the cause of his chest pain. And we ended up putting in 2 stents, and subsequently he did very well after that.
Bryan has been feeling so much better since the procedure. The day after the procedure, he woke up and goes, Pam, I can't believe how good I feel.
I feel better than I have felt in years. Thank you to the visionaries. Thank you to those who were generous in their donations to build this wing of the hospital and care for the needs of cardiac patients. It's made a difference in our lives, made a difference in our families.